Welcome back to another episode of Time Out with the Sports Doctor podcast, where life, sports, and medicine intersects. We are glad that you are part of this growing community where we strive to help you strengthen your mindset, help you grow your assets, and help you achieve whatever level of success that you want for your life. Go to our website at Dr.Derrick, thesportsdoctor.com, where you can find all the latest content, and you can also follow us on our social media channels. Now, let's get into this episode. Welcome back to another episode of Time Out with the Sports Doctor podcast, and we have another very interesting guest for you today. I did not ask you how to pronounce your name, so I'm just going to try my best. So we have Miss Taylor Herzer with us today. She is a physician associate by training, but also works in the wellness and aesthetic world as well. So welcome to the podcast.
Thank you so much for having me. I'm excited to be here.
Now, how'd I do with that last name?
You did a great job. A lot of people want to add a T in there, so you did great.
All right, cool. All right, so you live in Oklahoma City, Oklahoma.
Yes.
And like you mentioned, you've just undergone a major transition in your career. I'll let you give us a little background on that later. But what we're here today really to talk about, I think you're the first physician assistant associate. We talked about that right before we hit record that transition. I had a PA in my practice, which was probably like 2017, 18, and it was physician assistant at that time.
Yes.
And now I know it's physician associate, but I never have any disrespect with whatever the title is. I really appreciate the work you're doing. And I actually tell people, you know, I feel right now one of the best places to be in medicine is as a physician associate. Why? Because you do what I do as a physician, as a surgeon. Your training is very similar to that as medical doctors versus a nurse practitioner. Typically, they have been a nurse in practice and then they go back, where you actually take classes in the medical school, things of that nature. So let's just talk about your track to becoming, getting into your career and why you chose your career.
Yeah, absolutely. So I was the little girl that in kindergarten, when everyone said, you know, I'm going to be a ballerina or a rock star, I always said, I'm going to be a doctor. I'm going to be a doctor. I had some health issues as a kid, and my doctors just made a really big impact on me. And I thought, if this is a way that I can serve, this is what I want to be when I grow up. And then as I started doing a lot of internships and job shadowing, I realized kind of what you said. I get to practice medicine, make a difference, and do all of the things that I wanted to do, but also have that lateral movement, the ability to say, you know what, I'm graduating school when I'm 22 years old. I don't know what I'm going to want to do when I'm 50. But if I get down this career path as a PA, I'm going to be able to maybe start in emergency medicine and then go into aesthetics or wellness, maybe do surgery someday. And I loved the idea of that lateral movement of still being able to practice medicine, but not kind of being pigeonholed into wherever I matched at the end of med school and having to stick with that for the rest of my life. So just knowing, always wanting to practice medicine, but then finding that path for me that allowed me some flexibility in my career in the long run.
And tell us what that training program looks like after college.
Yeah, so admissions to PA school are extremely competitive. It is certainly not I didn't get into med school, so I go the PA route. I've been on many admissions boards. It's very challenging to get into, very competitive. The average GPA of my class was a 3.89. And so right out of undergrad, actually before I graduated undergrad, I started my PA program and graduated a few months into my PA program. But it is generally 28 months to a 3-year program. You have a year to a year and a half of didactic or classroom. Most programs are integrated into universities with medical schools, dental schools. Some have physical therapy and other healthcare professionals in there. You normally take your first few courses together. And then what we branch off and do is essentially general studies. So we are the best generalist out there. We don't go a deep dive necessarily into micro and the deeper depth things that maybe you do during medical school, but we have a really, really vast knowledge of diagnosis, treatment, presentation, and all of the things that we need to get out into the workforce and expand healthcare to communities that really need it, and also be great physician extenders is what I like to call us in a lot of areas where you may be able to, you know, see 12 more patients a week and care for them from a surgical standpoint if you have a PA that can extend you in your office by doing the clinical roles. PAs also practice independently, obviously. Some like to go by the assistant title and truly do fulfill that. For me, I've practiced autonomously as an emergency medicine provider since getting out of my training. That was my first job out of school. It's what I knew I was going to school to do, was to practice emergency medicine. And I've done that for the past 8 years. And I'm just now kind of transitioning out of that full-time role and into more of the functional medicine and aesthetic side of things.
Yeah, so you mentioned 8 years. So you finished up a couple of years before COVID, but you were in the emergency room during COVID-19. So talk about that early in your career. You know, you train one way and then you get thrown into COVID-19 in the emergency room. What was that like?
Yeah, that was a really emotional time. I've talked with many of my colleagues, and it feels like a dream. Like what we were living during that time was unprecedented, and we were going in every day and truly thinking that we were risking our lives. I've never been to war, but it honestly did feel like that, especially in those beginning months when we really didn't know what the death rate was going to look like. We didn't know how it was even transmitted, really. We thought it lived on surfaces for weeks. So every single thing that we touched, we were kind of afraid of. And I know that sounds extreme, but I was at a designated COVID hospital for the state of Oklahoma. And what that means is patients from all across the state, when they would be diagnosed with COVID-19 or SARS-CoV-2, and they were essentially needing hospitalization, they were shipped to us. So my perspective was also that of COVID is the dead and dying. That's all this is. I wasn't seeing the walking well and those that were just, having the sniffles. And so it was a really, really challenging time for me in my career. I spent hours every single night just pouring into any literature I could. I joined every possible clinician Facebook group and was collaborating with people from all across the country, all across the world, honestly, trying to figure out how to care for these patients. So I think that was really a phase in my career where I realized that we're not always going to have the answers, but we have to be lifelong learners. We have to admit when we're wrong, be willing to pivot. And I think the people that cared for patients best during that time were those that were more open-minded, willing to pivot. This was something that we had never seen before. And every single day we were learning something new about it. But it was definitely scary. And quite frankly, that is what kind of transitioned me into this new season of life, was looking for an outlet where I felt like I could still be taking care of happy, healthy people. Emergency medicine, on all the TV shows, it's glamorized as like doing chest compressions and taking care of gunshot wounds, but that's really not what it is. I mean, we do a lot of, sutures and med refills and primary care stuff because our healthcare system's broken. But during COVID, it really was what you see in the movies. I mean, it was just intubated people, very sick patients left and right. I mean, people on ventilators in the hallways, at least at the hospital that I was at. And I needed a way to take care of people that weren't dying. And so I knew I had an interest in aesthetics. I've always liked, Botox and filler and all of that kind of stuff. And I was like, you know what? I'm good with my hands. I'm great with procedures. I know my anatomy really well because of working in the emergency department. So I went and got certified and trained in aesthetic medicine and kind of branched out, opening my own practice with one of my ER physicians, and got into the aesthetics world. And then from there, he was practicing functional medicine, which was actually the first introduction that I had to what holistic medicine or functional medicine even was. I thought it was kind of like woo woo and, just make you feel good, rub your shoulders or something. I had no idea what it really meant. But seeing the transformations in those patients really opened my eyes to not everything requires a prescription. Obviously, there is their role. I still prescribe medications for my patients, but just seeing that there was another way to practice medicine and to help people with wellness and longevity, that's when my mind was kind of open to that different way of practice.
Yeah. And as you were saying that, I believe, wasn't Oklahoma one of the early epicenters? Was the nursing home there where
Yes,
there was
yeah.
an outbreak? Right. Yes. So,
Yes. Yeah, it
yeah,
was like 1 week. My family was calling me, asking me, about COVID, what I thought, if I had heard anything. And I distinctly remember coming home from a very late night shift on the phone with my mom. And I was like, this is not a big deal. It's going to be like the flu. Everyone's freaking out. It's not going to be anything. And then I called her about a week later, the day that it really like hit us. I mean, it was like
right.
a wave. We went
Mhm.
from nothing to like 80 patients with COVID in one day. And I called her and I was like, this is going to be bad. Like, we need to prepare for this. When it hit us hard and fast.
But I think from that time, when you started to, like you said, research, connect with people from all over the world, start to educate people about what COVID is, how can we care for each other, you still have carried that into your new career with education. As I mentioned before we started recording, the clips that you've had, if people have not been to your social media, they need to check it out just for wellness tips or education, not salesy stuff, but telling people and breaking down the science is really important because many times we know how Western medicine is as far as the training is procedure based, it's prescription based, and we have very limited outside of that. But the world existed for thousands of years and people took herbal medicine and people took supplements and they were able to survive and come up with different forms of treatment long before modern medicine was started. So being able to have an understanding of that takes extra effort because you're not going to typically get it. What I was telling someone, what I remember from medical school about learning about herbals or supplements is what was the interaction pharmaceutical standpoint with a blood pressure medicine or something
Mhm.
else? How could it harm you? What effects do we need to know? And that's all I really remember being tested on. So
Yeah.
anything else, you have to learn it on your own, to be honest.
Absolutely. And, one of the things that I learned through this transition of career, and again, I'm not, Western medicine has its role. I still pick up shifts in the ER. I'm not saying that it's a bad thing, but there's definitely a role for both. And what I didn't realize is that 25% of our pharmaceutical drugs that we prescribe are actually plant derived medications, and upwards of 75% are naturally derived, meaning that they're from plants, the marine microorganisms, animal products, and things like that. So when we talk about not learning this in school, it is pretty crazy because that was ours. That's my training on it as well. Is like this will interact with blood thinners. If they're on this, have them stop it before a procedure. But really, supplementation was only explained to us in a context of, if someone has low potassium, give them potassium. If they have low magnesium, give them magnesium. It was more repletion or
Replacement. Yeah.
replacement of something that they were deficient in, not optimizing health with supplementation. And in some contexts, even treatment with naturals and botanicals. So I think when we open our minds to things that we aren't necessarily taught in the classroom setting, that's when we really have that breakthrough in care for our patients, because we can not only understand the perspective that they're coming from, but also give them options, because that's something huge for me, is that shared decision making with my patients. I never want to just tell them what their treatment is. I want to give them options. Of course, in some situations, I can't give you enough turmeric to heal your knee. You're really going to have a knee replacement, but giving patients their options and letting them know that this isn't just a one-track treatment plan.
And what I would like to talk about now is wellness as a whole and dealing with patients. We know that we're dealing with, especially as a surgeon, you come to see me for one, maybe two things, that's it. But we know that from a primary care standpoint or from a wellness standpoint, you have to really understand all the systems and how they interact. And, your knee pain could be coming from a medical condition. It does not necessarily have to be because you have an injury. So when you're talking to your patients about wellness, about being proactive in their care, how do you have that conversation with them?
Yeah, I really tell them, and sometimes I call out the elephant in the room and I say, "Hey, this may sound a little bit woo-woo to you," and I like to use that term because it makes people chuckle and just kind of, takes the tension out of the room. And I say, but I like to address the patient from body, mind, and spirit, and as a whole person, not just this one complaint, trying to throw a medication or a fix at it, and then having to deal with the repercussions of that fix that I've tried to give you. And I also explain to them that no matter how many supplements or medications I prescribe them, if they don't make that decision in their mind and do the work at home, nothing I prescribe is going to outwork or outtreat the daily decisions that they're making. And oftentimes I'll make that connection of, you wouldn't just go to the dentist and have a dental cleaning every 6 months or a year, but not brush your teeth at home. So I need you doing the work at home. Whenever I'm making these recommendations for you, you have to make the right dietary choices. We have to eat a low inflammatory diet. We have to be moving our body. And that's meeting your patients where they're at. It doesn't mean that they need to be a CrossFit athlete. I have literally had patients in my practice that I say, I want you 15 times to sit in the chair and stand up, sit in the chair and stand up, and just building that leg strength, starting with the basics and meeting them where they're at, but explaining to them that it's not my job as your healthcare provider to cure and fix everything, that this is a partnership and you really do have the power to change your own health trajectory. And I think when you put your patients in the driver's seat, they really do trust you so much more, because it's no longer them coming in and being told what to do, but really feeling empowered to make changes at home. And then you're just going to give them things that complement the decisions that they're already making.
Yeah, I like that because I mentioned in my previous episode, many times people come to us to be told what to do. And when you have that mindset of the doctor can give me what I need to be better, then I think it kind of excludes you being, as a patient, being the active participant in your health. So I lead with education, but you have to make the final decision and then you have to implement it. I know I'm not the best patient myself. I tend to
None of us are.
right. I try to avoid the pharmaceuticals or avoid whatever. And I'll say, okay, but at the same time, if I'm going to avoid the pharmaceuticals, I have to do the other thing. I have to do the exercise. I have to watch my diet. The easy part might be just coming home, taking a pill, right? Versus actually doing all the things. But truthfully, you need both. Sometimes you need the dietary change, you need the exercise, you need the medication, and you might even need a supplement. So we cannot just isolate certain parts of our healthcare and focus on them without even paying any attention to the rest.
Absolutely. Yeah, they work
Yeah.
well together. And when you have a little bit of everything on your plate, not just one or the other, you don't want a whole diet of just meat or just veggies. We want a good balanced diet. And I say that, kind of metaphor for health. We often get so compartmentalized in our thinking that we have to only have all natural botanicals, or we have only prescriptions, and these two, bodies are at war. And that's just really not the case. And I think that we both definitely align on that belief system.
Yeah. So I want to talk about now being clinician, being in the ER, also having a wellness practice, but the entrepreneurship part. What mindset shift or mindset change did you have any challenges when you thought about, I want to be an entrepreneur and a provider? Talk to me about that.
Yeah, I do think that entrepreneurship can be taught, but I also think that there are some of us that from a young age just had that ingrained in us.
Yeah.
And I was definitely someone
The
that
lemonade stand.
yes, I was having the lemonade stands. I was braiding bracelets and selling them at recess. I mean, all of the things. Like I've always had a little hustle in me, and I just enjoyed that. I enjoyed the sale, and again, I enjoyed the education aspect of it, and just connecting with other people. And it really, really came to a head when I was trying to pay off my student loans aggressively, and I realized that the only way that I was going to be able to do that was to work more hours and more shifts. And I was credentialed at like 6 different emergency departments. In October of 2023, I worked 30 days in a row, like 30, 10 or 12-hour shifts. And I realized in that time frame that I am going to absolutely burn myself out. I'm not going to be able to do this long term. But the issue is, how do you make more money if you're not given more time? You know what I mean? You have to work more to make more, is the mindset of most clinicians. And so I kind of went back to those roots of like, okay, what can I do to make money without having to leave my home, leave my family, leave my husband, the things and the people that I prayed for my whole life, stepping away from them to focus on this pursuit of money, and not really even of like the grander things, but just paying off student loans, which my generation going to PA school, med school, etc., like our interest rates are insane. I don't know how anyone is paying off their loans. It's so challenging. And so I just needed a different way to do that. And then the other thing is, without tooting my own horn, I'm an extremely hard worker. Like no matter what emergency department you put me in, no matter what clinical setting or non-clinical setting, even if you're playing board games, like I want to win and I want to outwork everyone. I'm very competitive. And so I realized like I could see more patients than every single other clinician on shift, physicians included, and I didn't make any more money. And that's okay. It's not all about the money, but I have that hustle in me. I have that grind in me. I want to reach the full extent of my potential, and I want to practice at the full extent of my licensure. And by working harder and harder and harder, I was just burning myself out. I wasn't actually making any more money, and I was making CEOs richer and the people that employed me really happy, but I wasn't doing anything that filled my cup. And entrepreneurship really does that for me. You see a direct correlation with how much work you put in and how much you get out, the lives that you're impacting, and also the financial return on that. So I think it was really just recognizing my personal skill set, my personal attributes, the hustle and grind that I have just innately in me. And entrepreneurship rewards that a lot more than kind of our traditional employment model that we have in medicine, but also just kind of in the US.
Yeah, a couple of things from what you said. Number one, to put it into perspective, the average amount of shifts in a month is what? Probably about 12 to 18, 12 to 15, somewhere like that.
Yeah.
So somebody might hear 30 days and say, oh, that's nothing, but that's almost double, at least double, maybe a little bit more than double what a
Yeah.
normal ER workload is. And then the other thing is, we were human beings, we were people, we were sometimes grown-ups before you ever became a physician assistant, before you became a nurse practitioner, a surgeon, whatever. You were a person for 20 plus, maybe 30 years before then. So why do we feel that once you get that title, that's the only thing you should be? And I think in many arenas, people feel like once you have that title, that's it. You're stuck. You're okay, why are you trying to do this when you're a doctor? Why are you trying to do this? You're a surgeon. Shouldn't you see more patients? Shouldn't you work more shifts? But there is a ceiling that you're going to hit. And like you said, you can max out the amount of patients you can see. You can max out the amount of days you're going to work. However, when that check comes in the mail, a good portion of that has to go back to the government, right? So you have to pay taxes on W-2 wages versus some of the other things that you can invest in or other outside jobs. Those things can supplement your 9 to 5 or your 7 to 3 or whatever it may be and augment what you're doing versus it being in that same piece of pie. So that's really important. And don't forget about who you are. So many people that are listening to this are still in training, medical students, still on their route to becoming the person that they want to be. So don't forget about all your skills, all the talents that you have. Sometimes obtaining that next degree is just opening up more doors for you to really be who you are.
Absolutely. I fully agree with that. And I love that you said not losing yourself in it, because I do think when we talk about going down any other avenue of even practicing medicine, when I told, my ER colleagues that I was going to be opening this aesthetics and wellness practice with one of the ER physicians I was working with, their eyes rolled in the back of their head. They couldn't believe that. Why would you be doing anything other? Oh, you're going to be so bored with that. You're an ER person to your core. Even switching specialties of medicine can get an eye roll from your clinicians and or from your fellow colleagues. And so you then get into talking about entrepreneurship and investments and side hustles, if you will, and it is just like mind blowing to many people in medicine. So I do think realizing that our identity is not found in the letters after our name, which oftentimes we are fully associated with, and then it's also not a lack of integrity, a lack of care for others, or you're not leaving your calling whenever you're going and doing something else. You could be finding the thing that is just as fulfilling, but just another facet of who you are and another gifting that you've been given, even from maybe birth. And sometimes you find that out later in life. But I definitely think diversifying what you're doing is not something to be demonized or looked down upon. It really is a beautiful thing, and you kind of discover different facets of yourself through that.
Yeah, totally agree. Totally agree. So now let's transition a little bit into Bravenly Global. And how did you discover Bravenly? Why did you consider it as a clinician as part of your practice?
Absolutely. So about a year and a half ago, I was realizing as I was traveling into work that I would have tears streaming down my face. I was missing my daughter every single day. With emergency medicine, you're either missing wake up and breakfast or you're missing bedtime, and that is just a guaranteed. And then on my days off, I was exhausted, and I was also working at my aesthetics and wellness practice. And so I'm a woman of faith, and I just started praying for a way out. I knew that God was calling me out of the emergency department, but I didn't know how that was going to be possible, because many of us suffer from lifestyle creep. Every bit of money you make, somehow it ends up going out, no matter how much more you make. Yeah. And so my husband is an extremely hard worker. He's an entrepreneur and he owns his own business. But at the end of the day, we did rely heavily on my income. So it wasn't just okay, I want to be a stay-at-home mom now and I get to quit all my jobs. And so I was really kind of praying for guidance and answers. And that's when one of my fellow PAs was sharing about Bravenly. And she shared with me this opportunity to bring Bravenly to my network and to my community. And I then researched it heavily. I prayed on it heavily. I looked at the founding family. I looked at the morals and integrity of them. I think that is super important. If I'm going to be working for anyone else, if it's not a hospital setting, I want to make sure that I align with the goals and kind of the projections of the company, their mission statement. I looked heavily into the products, the formulations, our formulators, all of the compensation plan, everything about it, and everything about Bravenly aligned with what I was wanting for my career, but also as a woman of faith and morals and values, that all just aligned with me so well. And so I spoke in depth with this PA, colleague of mine. I've known her for many years from previous business ventures with her. And I thought, if she's putting her name on this, she's made this transition. I don't see any red flags in everything that I've dug up about this company. It's something worthwhile and something to try. And it has just been, honestly, probably the smartest step I've taken in my career. It's been life-changing for myself, my family, and many other clinicians and non-clinicians that I've been able to share this with. And so I'm so grateful that it was presented to me at the time. And I think it was definitely the answered prayer that I was looking for.
Are you a young physician who's frustrated in figuring out how you're going to continue to fund yourself through this early phase of your career? Are you tired of speaking to lenders who do not understand your plight? We have a solution for you. Let me introduce you to Doc2Doc Lending.
Hey everyone, I'm Dr. Zwade Marshall, co-founder, CEO of Doc2Doc Lending. We are the exclusive lending partner for physicians and dentists in the United States. We underwrite our loans thoughtfully, knowing the physician journey and your career trajectory. We're a company that's been founded by doctors and built for doctors because we get it. Banks don't understand all the ways in which we struggle through educational debt, consumer debt, as we're trying to make ends meet during a very challenging time of our lives. Doc2Doc is underwritten with thoughtful process that's meant to give you credit for all the unique physician characteristics that you have, like being board certified, having a dual degree, undergoing and finishing a specialty or a fellowship as well, and just being employed as a physician. All of those things give you credit to get your interest rate lower with our platform.
So we are glad to partner with Doc2Doc Lending. So if you are stuck trying to figure out where you can get funding or where you can continue to support your family during this time of transition in your career, we offer you a solution. Doc2Doc Lending, physician owned, understands your plight, understands what it's like to be an early physician or a physician who wants to do something outside of medicine. Check out Doc2Doc Lending. This segment is a paid advertisement for Doc2Doc Lending, Inc. Loans are made available by DR Bank, member FDIC, and are subject to credit approval and available in approved states only. Representative APRs for Doc2Doc range from 9.99% to 26.99%. Terms and conditions available at doc2doclending.com. So as a clinician, when you were entering into this space, what was your thought? Because I know many people, I'll speak for myself, as have reservations to selling anything. I don't want to sell anything to my patients. I don't sell them procedures. I don't sell them products. I educate them and let them decide. So did you have any drawback with that? And how did you approach that part of the business?
Yeah, I think you said it perfectly. We put the title of sales on it, but I don't feel like I'm a sales rep. I feel like I'm someone that educates people on their options. I give them their options, and then they get to choose to partake or not partake in either the business or the product side of this. And so when we don't think of ourselves as salespeople, but as educators, I educate people on the risks and benefits of the procedures I do in my clinic. I educate people on COVID. I educated people on everything that I do. I mean, my passion truly is educating. And so I don't look at this as a sales job. I look at this as an opportunity to present people a business opportunity to change their financial health, and also as an opportunity to take their health into their own hands without having to necessarily pay the large fees that it generally takes to see a functional medicine clinician like myself. And so, yeah, I don't necessarily look at it as sales. Obviously, it is a sales model, but I didn't look at it as, oh man, I'm going to be like hawking products at people. I looked at it as just another product line that I would be offering to my network that could benefit them. And if I have access to something that's going to benefit my audience, I know it's safe and efficacious, I'm definitely not going to gatekeep that out of my own pride or concerns of what people may think about me sharing about a product line.
Yeah, and I think that part is really important, kind of putting that piece to the side about your pride. Or even like when I launched this podcast, I wanted people to listen to it. I wanted people to know about it, but I didn't want to tell people about it.
Yeah.
I didn't want somebody walk in, another clinician walk in and say, oh, I hear you have a podcast, or a patient say, oh, I found out about your podcast. I was like, good. Okay. And let's go on to the next subject. And I think you have to become comfortable with whatever space you're walking into, whether it's being a speaker, starting a podcast, taking on an entrepreneur role. I think you have to first be comfortable with it before you start to engage with other people. And then part of it is actually just speaking about it and not even worrying about where it lands. Okay, I'm going to tell you that I believe in this. I think it can help you this kind of way, and then leave it alone, versus trying to make sure that you're, okay, let me give you this information. You read about it, just tell them about it and be done with it. It's the approach I think that I take. And if people want to discuss it further, they'll ask questions. If not, we keep it moving.
Yeah, absolutely. And, I was told this metaphor or story early on, and it really stuck with me. And it's a story about a waitress coming up to the table at the end of the meal, and she says, okay, guys, what do we want for dessert? And you're like, okay, what are my options? She tells you what the options are for dessert. And then one person at the table is going to be like, oh man, I'm stuffed. I don't want any. No, thank you. The other person may get some. Then the next person, they don't want dessert this time, but next time they come in, they may get the key lime pie. And that waitress doesn't walk around like crying and identifying with the fact that only one person wanted the key lime pie at the end of the dinner, right? It just wasn't the right time for this person. They came back next time. This person was absolutely full with what they had already eaten. They didn't want it. And the one person that needed it, she served them. And so that's kind of my perspective with this, is I'm not looking to convince anyone. I'm putting this out there. I'm offering you something great. If it's a good fit for you, fantastic. And if it's not, we can move on, just like with what you just said. So I fully agree with that. We're not here to convince anyone. I'm just here to share an opportunity. And if it's a good fit for you, if you're like me and you're praying for an answer, I have to be the one sharing, because someone else could be out there looking for a breakthrough in their health, or looking for a way out of a dire financial situation. And I would hate if I allowed my own pride to keep me from sharing something that could change someone else's life.
Yeah, and I can guarantee you someone was sitting at that next table waiting on your reaction to say, okay, you know what? They liked it. I'll take a piece of that key lime pie as well. So
Absolutely.
You never know by you getting started how that's going to impact the next clinician, the next person, the next patient, whoever. I feel that we are so interconnected. And sometimes I was just reading a book, and if you don't reach your full potential, then how does that affect your next generation, or how does that affect your parents or your neighbors or whoever? Because many people are looking for someone else to either fail or succeed before they feel that it's safe. And someone has to be the first one to kind of be that trailblazer.
Absolutely.
Let's talk about work Bravenly balance. How do you do all the things? You mentioned just transition from the ED career, but you still have a wellness and aesthetics practice. How do you balance that? I know that it's kind of intertwined being with the wellness part of it, but how do you balance all the things you do with Bravenly?
Yeah, I'm sure we've all heard the phrase, if you want something done, give it to someone who's busy. And I think that's definitely true for a business like this. But I think a lot of people get overwhelmed with the idea of starting this because they think it has to be a full-time career, and it definitely doesn't. I don't have time to work this full-time. And that's not a lack of priorities or I binge Netflix. Like, I don't sit around watching TV all day long. I work a full clinical schedule, and I'm just now getting out of having two full-time jobs. As of 2 months ago, I wasn't full-time in the emergency department anymore because Bravenly, look at the income disclosure statement, but I was able to match and surpass my full-time income in 10 months with Bravenly. And so I was able to step away from that. But I am working this in the mornings before I go to work. I'm working this between patients. If I get a question, I respond to it quickly with a voice note. And then at night, when I put my daughter down, instead of most people turning on Netflix or, going and eating the cookie dough in the fridge, I sit down and I work my business and I share about the products and I create my content and I do all of that. And I hate saying the nooks and crannies of my day, but I make it a priority because I know that this is going to be the thing that allows me that additional time freedom and financial freedom with my family. So I'm making those sacrifices now for the long term. So many of us look at the prestigious sacrifice of 10 years of education to become a surgeon. You have med school, you have your residency, you have your fellowship, and then you get out and they're just, oh, they're praising you for all of that. And it took you 10 years to get where you're at just to start your career. And that's praised. But something like this, it may take a year, 2 years, 3 years to really get to a point where it is a full-time income for people. But can you not build that in the nooks and crannies of your day to make it something that is life-changing for you? So I work it in the mornings before I go to work. I work it between patients. I work it when I put my daughter down at bed. And then some days I have to prioritize things like this. My husband is a great support system for me. He is keeping my daughter, in the other room watching Cinderella or whatever right now, playing games while I'm doing this so that I can share more about this opportunity and about my career path and about my story. So I think making it a priority, but working it in where you can and not feeling like it has to be 100% or nothing. This doesn't have to be a 40-hour-a-week job for you. Work it how you can, when you can, and give it your all when you're doing that, and you're going to see progress over time.
And I think the beautiful part about it is that you can do it from your laptop. You can do it from your cell phone. Many things are just sending a message to someone, following up on an email. So it does not have to be where you leave your bed or leave your house to physically drive to a location. So if you actually want to prioritize it, you'll find little gaps in your day while you're sitting waiting on your kids to be picked up from school or dropping them off and they're waiting on them to come out of practice. Those are all times that you could use to connect with potential partners or potential customers. So I think this is something that you can really intertwine, weave into your day if it's a priority for you.
Absolutely. And I always tell people when they tell me they're too busy for this, I ask them to screenshot their screen time on their iPhone. It'll tell you how many hours a day you're spending on your phone. And so we have this perception that we don't have any time, but really we're just filling it a lot of times with nonsense and scrolling and Netflix and Hulu and all of the subscriptions and just things that don't bring us value. And so when you really do shift that time of scrolling and consuming content and consuming worthless television and things like that, you really can make leaps and bounds in other areas of your life, whether that just be personal development, reading, whatever that may be, or a business like this. You really can maximize your 24 hours when you actually look at how you're spending it right now and then redelegate to the things that are most important to you.
Absolutely. Well, thank you, number one, for coming on. Thank you for the education. I really look forward to continuing to grow in this business, alongside you and other practitioners, because like I mentioned, we have an important role in wellness, in patient care, in being an advocate for our patients and for the greater good of getting the word out to, those that can help. And you never really know who can be impacted by this until you start to speak about it and just share your own testimony and the testimonies of other people. And that really speaks loudly, more so than even just trying to push a product, is sharing a testimony with someone.
Absolutely. Well, thank you so much for having me on. It's great to have someone else who is, patient-centered in their practice, but also in their life, and utilizing other areas to help your patients or Bravenly clients. Just commend you for that. And thank you so much for having me on tonight.
Sure. And tell everyone how they can follow along with you or if they want to join into what you're doing.
Yeah, absolutely. So my name is not super common, but I'm Taylor Herzer on Facebook and then Taylor Herzer on Instagram. So it should be super easy to find. I do give, health and wellness tips. I give aesthetics tips and just normal mom life. So if you like any of those things, definitely give me a follow and I'd love to connect.
All right, excellent. And we'll include that all in the show notes. Well, thank you very much for coming on.
Thank you.
Thank you for continuing to support this podcast. If you enjoyed this episode, then please leave a 5-star review. And if you haven't done so, subscribe so you continue to get the updated episodes. Until later, peace.
Hey, time out with the sports doctor. Keep our head right in the game. We ain't never stopping. You are now tuned in. Trust you don't want to miss. This is where life, sports, and medicine